So what we're looking off here is just putting together a virtual patient care project that looks at various different target audiences. In the discussions that we've had over the last couple of weeks, is really looking at those vulnerable target groups that, Jane, you've also mentioned those vulnerable population groups, and how do we offer them help? And especially in South Africa, where we have such a large population that don't have access to treatment, how do we get them more support and more virtual or online patient care? And we kind of started to identify and break that down. Single parent household women, again, that are suffering from depression and anxiety and any mental health conditions, disadvantaged or at-risk youth, unemployment. I mean, these are all really, really key themes in South Africa, and a very large percentage of people who don't have access. We're looking at 1 in 10 South Africans only having access to treatment. And that's a huge proportion of people who still don't. And I think it's just to really focus on providing more resources to these vulnerable groups, especially with little resources, low data, little access to technology. How are we able to get mental health to them at their fingertips? An interesting thing that we could also add here is the link to comorbidities in mental health: HIV, TB, cancer, diabetes. And it's also adding mental health support to that target audience as well, or that population group.
Support the idea. I mean, we've got very much the view of like a stepped care approach. So I think that talks to the whole idea around being able to step people up to the appropriate level at the right time. And I think that'll be quite important as well. When you've got limited resources, how do you appropriately use the technology to identify who should be stepped up and who shouldn't?
The other concerns around the South African environment is obviously the multi-language facilities that we need, and then also accessibility in terms of the human factors.
A lot of cultures don't recognize mental health as an issue, like a taboo when someone talks about being wrong with their mental health. So we have to take into account the cultural aspects when developing any kind of programs or services for mental health.
My team is specifically going to start focusing on how can we provide the underlying platform and support in order to achieve virtuality or digital connectiveness or whatever you want to call it, but also at the same time provide flexible capability. In the previous conversation, we did talk about the continuum, but at the same time, the very specific nature of the individual groups.